When you're dealing with a massive heart attack, you're literally in a race against the clock. Today, we're going to talk about Reteplase, a super powerful clot buster that's designed to win that race. So let's dive in and break down exactly how this emergency drug works.
Okay, so just imagine for a second. The ambulance is on its way, lights and sirens, and a patient is in the middle of a major heart attack. In that exact moment, what's the one single thing, the biggest, most immediate enemy that the medical team is fighting?
Believe it or not, it's this, a single, tiny but catastrophically placed blood clot. This one little blockage is the bad guy here. It's the dam that suddenly stops the flow of life-giving blood from getting to the heart muscle.
So, to really get how we fight this enemy, first we need to understand the crisis itself. We need to take a closer look at what this blockage is all about.
The official medical name for this thing is a thrombus. You can think of it like a complete traffic jam on the most important highway in your body, a coronary artery. And we're talking about a really specific, really severe type of heart attack here, called a STEMI. That's where the artery is totally 100% blocked. The second that happens, the heart muscle starts getting starved of oxygen, and the countdown clock officially begins.
So how in the world do you clear a biological traffic jam that's this bad? Well, you don't call a tow truck, you call in the demolition crew. You send in Reteplase, the ultimate clot buster.
So how does this demolition job work? Well, Reteplase is a special kind of drug called a plasminogen activator. Its one and only mission is to hunt down that clot and basically dismantle it from the inside out. It does this by attacking what's called the fibrin matrix. You can think of that as the sticky biological net that's holding the whole dangerous clot together.
So how does it shred that net? It kicks off this brilliant little chain reaction. First, Reteplase is injected right into the bloodstream. It immediately finds this substance that's just hanging out in your blood called plasminogen, and it flips its on switch. That plasminogen then turns into its super active form, which is called plasmin. And plasmin is the real hero here. It works just like a pair of molecular scissors, slicing and dicing that fibrin net into pieces until the whole clot just dissolves.
And get this process is fast. For most people, Reteplase gets the blood flowing again, that's called reperfusion, in about 90 minutes. Now, in the world of heart attacks, every single minute means more heart muscle is dying. So 90 minutes, that can be the difference between a full recovery and serious permanent damage. It's huge.
But you have to remember, a drug that's powerful enough to dissolve a blood clot, well, it's also pretty dangerous. You can't just give it to anybody. And that brings us to maybe the most important part of the whole process, the patient safety checklist.
I mean, it's the obvious question, right? You've got a patient whose life is on the line, and you have this drug that could save them. So can you just give it to every single person who's having this type of heart attack? The answer, surprisingly, is a hard no.
This right here, this is the absolute no-go list. In medicine, they're called contraindications. For any doctor or nurse, this is a non-negotiable checklist. If a patient has any of these issues, like say a history of bleeding in the brain, or they just had major surgery, the risk of causing a massive, uncontrollable bleed is just way too high. In those cases, the clot buster could actually do more harm than good.
So you can see the razor's edge that clinicians are walking. The perfect candidate is someone with that life-threatening clot, but who also has a clean bill of health otherwise. But for someone else, say with a history of a brain bleed, well, the cure could literally be more dangerous than the disease.
Okay, but let's say we have the perfect candidate. Even then, we're not totally out of the woods. A drug this powerful always comes with some serious risks and potential drug interactions that everyone needs to be aware of.
And here's the key thing to get. The drug's greatest strength is also its biggest risk. Bleeding is by far the most common side effect. And that makes perfect sense, right? A drug that's awesome at dissolving clots can also make it harder for your body to form the good clots you need. You might also see other things like some weird, irregular heartbeats for a little while as blood rushes back into the heart muscle after being starved.
Now, I really want to highlight this warning because it is absolutely critical. A lot of heart attack patients also get another blood thinner called heparin, but this quote right here from the official instructions is an unbreakable rule. Reteplase and heparin do not mix. You cannot, under any circumstances, run them through the same IV line. If you do, you could cause a really dangerous chemical reaction right there in the tube. And that same level of caution, that intense precision, it carries over into exactly how the drug is given. It's not just one shot and you're done, it's a very specific 2-dose protocol.
It all revolves around the number 2. It's a two-part treatment. The whole idea is to deliver a really strong first punch to start breaking up the clot, and then follow it up with a second wave to make sure the job gets finished.
And the other magic number to remember? 30. There is an exact 30-minute wait between that first dose and the second one. And that timing isn't a suggestion. It's absolutely crucial for the drug to work the way it's supposed to, safe-free.
So here's the full play-by-play, and you can really see the precision here. First, a 10-unit dose is pushed through the IV over 2 minutes. Then, the line gets flushed with saline. That's to make sure every last drop of the drug gets into the body and to clear the line. Then you start a timer for exactly 30 minutes. Once that's up, you give the second 10-unit dose, again over 2 minutes, and then you do one final flush. It's a very structured, very careful process.
And one last thing to remember. Reteplase is a team player. It's not out there working all by itself. It's almost always part of a cocktail of medications, including things like aspirin and heparin, which of course are given in a separate IV line, to help prevent any new clots from forming while the old one is getting busted up.
So, what we're looking at here is a drug that's powerful enough to stop the root cause of a heart attack dead in its tracks in less time than it takes to watch a movie. It's an incredible piece of biochemical engineering. But it's also a double-edged sword that you have to handle with absolute precision. And it leaves you with a pretty big question. As our medical tools get even more powerful and more precise, how are they going to keep changing the race against time itself?